Hello all, hope you're having a great day today. Today we are talking about comprehensive program design. This is chapter 13. So our objectives are really that a fitness professional should be able to describe the physiological and psychological benefits of a comprehensive exercise program. They should also be able to describe the components of a comprehensive exercise program. And they need to consider the advanced training options as well as understand the anatomy of an exercise program. Personal trainers have the opportunity to assist clients in creating exercise programs that not only help to prevent a number of hypokinetic diseases such as coronary heart disease, diabetes, low back pain, but also improve fitness quality of life. As highlighted in this chapter, a comprehensive exercise program provides many physiological and psychological benefits. A well-rounded fitness plan follows a general format, including a warm-up, the conditioning phase, such as cardiorespiratory exercise and or resistance exercise, a cool-down and flexibility exercise, and when indicated, neuromotor exercise training. For some clients, more advanced options with a greater focus on skill-related components of physical fitness may be appropriate. So a comprehensive exercise program has many potential physiological as well as psychological benefits. The physiological changes as a result of a comprehensive exercise program provide many fitness and health benefits, such as improvement in cardiovascular and respiratory function. Aerobic activities in which large muscle groups are used dynamically for extended periods of time place demands on the cardiovascular and respiratory systems in addition to the skeletal muscle system. By placing a stress on these systems, a cardiorespiratory fitness can be improved. There are increases in cardiorespiratory fitness that are associated with the reduction in death from all causes. Conversely, low cardiorespiratory fitness is associated with increased risk of premature death, in particular death from cardiovascular disease. Prevention of risk factors, or primordial prevention, and treatment of risk factors, such as primary prevention, are both important considerations considering the high prevalence of heart disease. Some primordial risk factors cannot be changed or prevented, such as age, sex, or genetics, but others include physical inactivity can be addressed. Risk factors such as dyslipidemia, prediabetes, hypertension, and obesity are positively impacted with regular physical activity. Greater cardiorespiratory fitness in individuals with pre-existing disease is associated with decreased risk of clinical events. Physical activity and exercise are known to prevent the development of several life-threatening diseases, as well as premature death. Morbidity and mortality rates in a population can be directly affected by the quality and quantity of physical activity and exercise. Morbidity refers to the amount of disease in a given population, whereas mortality refers to the amount of death in a population. All-cause mortality is delayed with regular physical activity, whereas mortality is also delayed when individuals who were previously sedentary or insufficiently active increase their physical activity to meet the recommended levels of physical activity. The Centers for Disease Control and Prevention publishes a weekly report providing information on these rates in the United States called the Morbidity and Mortality Weekly Report. According to the Centers for Disease Control and Prevention, each year about 1 in 4 adults older than 65 years will experience a fall that leads to moderate or severe injury. Severe falls can cause injuries affecting mobility as well as brain trauma and can lead to other health conditions or disease. Falls may be linked to a lack of muscular strength and endurance, balance, and coordination. Regular physical activity, muscular fitness, cardiovascular fitness, flexibility training, and balance exercises can improve daily functioning and decrease the risk of falling. Neuromotor exercise training, also called functional fitness training, which includes balance, coordination, gait, agility, and proprioceptive training, is a beneficial component of a comprehensive exercise program for older adults to reduce the risk of falls. There's an increase in metabolic rate. The metabolism is the rate at which bodily tissues break down and utilize energy consumed or calories. Unfortunately, metabolic rate declines steadily as a part of the aging process. If energy is not utilized, it is most often stored in fat cells. Typically, as individuals age, they become less and less physically active, losing muscle mass, thus contributing to this steady decline in metabolic rate. Participation in a comprehensive exercise program, including cardiovascular and resistance training, will attenuate muscle loss or promote lean muscle gains, which can potentially maintain metabolic rate. As with heart disease, bone health is affected by factors that cannot be modified, such as age, sex, race, and genetics, as well as those that can be changed, that diet and physical activity in particular. Exercise to increase bone mass or to prevent age-related bone loss require loading of the bone in site-specific manner. Impact in weight-bearing activities such as plyometrics, jumping, resistance training provide for a stress on the bone to promote positive adaptations in the bone. Obesity is related to many chronic diseases such as coronary heart disease, hypertension, stroke, type 2 dyslipidemia, and some cancers. Physical activity is recommended as part of a complete weight management plan for prevention of excessive fat gain, for weight maintenance, and to enhance weight loss strategies. In fact, evidence suggests a dose response with exercise, meaning there may be greater weight loss with greater amounts of physical activity. Although American College of Sports Medicine, or ACSM, recommends participation in at least 150 minutes per week of moderate intensity activity for weight maintenance and reduction in chronic disease risk, 250 to 300 minutes per week of moderate intensity activity may lead to greater weight loss. In addition to the many physiological benefits, regular exercisers may also experience a number of potential psychological benefits. Depression is marked by feelings of sadness and unhappiness, along with being self-critical and having low self-esteem. In addition to impairing daily function and potentially creating difficulties in work and home life, depression is also associated with health risks, such as heart disease. Exercise, both aerobic exercise and resistance training, has been found to be helpful in treating mild to moderate depressive symptoms. To lessen depressive symptoms, to potentially reduce the risk of developing depression, and to work in conjunction with medication-based antidepressive therapy for those with diagnosed major depression. Anxiety is an emotional state marked by excessive anticipatory worry and tension. Unlike fear, which is a reaction to present danger, anxiety is a future-oriented. Anxiety-related worry is related to upcoming events, real or imagined, over which the person has little control. Symptoms of anxiety disorders include both acute, short-lived psychological responses that are linked to a particular situation, called state anxiety, as well as chronic long-term tendencies to become anxious, called trait anxiety. Exercises has been linked to reductions in both state and trait anxiety. Exercise provides enhancement of self-esteem, more restful sleep, and faster recovery from psychosocial stressors. Exercise also has the potential to enhance emotional well-being and to improve mood, and to enhance feelings of energy and quality of life. High stress is when the perceived demands appear to exceed the resources available to handle those demands. Stress is associated with a number of health risks, including weakening of the immune system, overeating, and adverse shifts in blood lipid levels. People with depression, those suffering from stress and hostility, have the same risk of heart attack as those who smoke or have high blood pressure. However, exercise and physical activity have potentially positive effects on stress. For example, exercise training has been shown to reduce depression, overall stress, as well as hostility by 50 to 70%. Regular physical activity, both aerobic exercise and resistance training, is associated with reduced risk for dementia or cognitive decline in older adults. For example, individualized aerobic training at the ventilatory threshold was found to improve cognitive function to the same level as a mental training program. Exercise and fitness effects are the greatest for tasks that require complex mental processing, in particular executive control tasks such as coordination, inhibition, scheduling, planning, and working memory. The optimal exercise program should address the health-related physical fitness components of cardiorespiratory fitness, muscular strength and endurance, flexibility, body composition, and neuromuscular fitness. In addition, skill-related physical fitness components can also be added, and they include agility, coordination, balance, power, reaction time, and speed. Including activities to improve aerobic fitness, muscular fitness, and flexibility are recommended for everyone. Neuromotor exercise, which includes skill-related physical fitness components, is advocated for those at higher risk for falling, in particular older individuals, although there are likely benefits for younger adults as well. Additionally, some clients have goals related to sport or competitive activities in which the skill-related components need to be addressed. The FIT VP principles of exercise prescription allow for complete design of the frequency, which is the F, intensity, time or duration, and type or mode of exercise, plus the overall volume or amount and progression of the exercise. Within the FIT VP framework, the personal trainer can develop individual exercise prescriptions, as discussed in more detail in the upcoming chapters in this section, which include cardiorespiratory and muscular fitness exercises, as well as flexibility promoting activities. Cardiorespiratory endurance refers to the ability of the heart and blood vessels, or the circulatory system, and the lungs, the respiratory system, to provide oxygen to the body during sustained physical activity. Another term commonly used is aerobic fitness, such as these activities require sufficient oxygen in order to be continued. Maximal oxygen consumption can be measured directly by analyzing expired gases, or may be estimated from submaximal effort. For examples, see chapter 12 for examples of submaximal exercise tests or maximal effort. The higher the VO2 max, the greater is the individual's aerobic capacity. Although some activity is better than none, the recommended frequency for aerobic exercise is 3 to 5 days per week. When determining optimal frequency, intensity should be considered. More frequent exercise sessions, such as 5 days per week, are typically used in conjunction with moderate intensity exercise programs. As intensity levels increase, the number of days per week needed for health benefits decreases. The incidence of injury may also increase with the vigorous intensity exercise done more than 5 days per week. Although some activity is better than none, the recommended frequency for aerobic exercise is 3 to 5 days per week. Exercise intensity can be quantified using various methods, including heart rate reserve, percentage of age predicted maximal heart rate, oxygen uptake reserve, and perceived exertion. The intensity recommended for a given individual depends on that person's habitual activity and fitness level. For individuals who are sedentary and very deconditioned, the recommended intensity is very low, such as 30% to 39% of heart rate reserve, or for oxygen uptake reserve, but progressively increases with higher activity and fitness levels. For habitually active individuals with high fitness, 60 to 89% of heart rate reserve or oxygen uptake reserve. Exercise duration is the amount of time the exercise is performed, typically expressed as minutes per day or minutes per week. General baseline targets for time spent exercising depend on the intensity of the exercise. Thus, the recommendations link duration and intensity. Moderate intensity exercise is recommended at least 30 minutes per day on at least 5 days per week for a total of at least 30 minutes a week. Or vigorous intensity exercise is recommended at least 20 to 25 minutes per day on at least 3 days per week for a total of at least 75 minutes. Or a combination of moderate and vigorous intensity exercise at least 20 to 30 minutes on 3 to 4 days per week. A dose-response relationship exists between physical activity and health outcomes. Thus, benefits may begin at low levels for sedentary individuals, less than 20 minutes per day, whereas extending the time or intensity may provide additional health benefits for those who are already regular exercisers. For example, one may gain even greater benefits with the following: moderate intensity exercise of 300 minutes per week, or vigorous intensity exercise of 150 minutes per week, or a combination of those. Going above the baseline of 150 minutes per week of moderate intensity exercise also is important to assist with weight loss or to help maintain weight loss. In these situations, the recommended duration of exercise is 50 to 60 minutes per day, or 250 to 300 minutes per week. These recommendations provide a framework in which the personal trainer or fitness professional can develop a health-enhancing exercise program. Examples of aerobic activities include walking, jogging, running, cycling, swimming, or using aerobic-based machines such as a stair climber or elliptical machine. Although most of these activities require low to moderate skill and can be used even by those with low fitness levels, others require considerable skill, fitness, and practice to master. Chapter 15 provides a classification system which acknowledges the fitness and skill level required for optimal use of various aerobic exercises. Activities appropriate for everyone have minimal skill or fitness prerequisites, such as walking. As fitness increases, more intense activities can be included, such as jogging. Still, other activities have a major skill component, such as swimming, that may be acquired before including in an aerobic training program, or have a competitive nature, such as team sports, that require at least average physical fitness. Exercise volume plays an important role for realizing health and fitness outcomes, particularly with respect to body composition and weight management. Exercise volume should be used to estimate the overall energy expenditure for an exercise prescription. Exercise volume is typically measured in metabolic equivalent, or a MET, per minute per week, and or kcal per week. Note that volume can also be tracked on a daily basis. In 13.2, it reflects the standard exercises measures of exercise intensity, such as METs, or MET per minute, and kcal per minute for different physical activities. These values can be used to calculate volume of activity per week that is accumulated as part of the exercise program. The recommended volume that is consistently associated with lower rates of cardiovascular disease and premature mortality is greater than 500 to 1,000 METs per minute per week. This is approximately equal to 1,000 calories per week of moderate intensity physical activity, or around 150 minutes per week of moderate intensity exercise. An intensity of 3 to 5.9 METs for people weighing 68 to 91 kilograms, or 150 to 200 pounds. In deconditioned people, lower exercise volumes can have significant benefits, but even greater volumes may be needed for weight management, so to exercise for a longer period of time is more important. Progression depends on an individual's health status, training response, fitness, and exercise program goals. Progression allows for improvements in cardiorespiratory fitness while avoiding stagnation in training. The personal trainer or fitness professional may need to increase any or all of the fit components to provide progression to the exercise program. Typically, only one variable is increased at a time. Initially, an increase in time or minutes per session is recommended. After about 1 month, the frequency, intensity, and time should be gradually increased over the next 4 to 8 months to meet the recommendations presented in ACSM's guideline for exercise testing and prescription. A longer trajectory is recommended for those who are very deconditioned. Any progression should avoid making large increases in the fit components to minimize risks of injury, muscular soreness, or overtraining. Progression depends on an individual's health status, training response, fitness, and the exercise program goals. Progression allows for improvements in cardiorespiratory fitness while avoiding stagnation in training. Chapter 15 goes into more detail on cardiorespiratory fitness training programs and incorporating the fit volume progression principle into a usable program for a client. A sample progression, including activity status and training focus, is provided in Table 13.1. And here you see actually 13.2, which is the calculation of the METs, the MET per minute, and kcal per minute. An index of energy expenditure, a MET, is the ratio of the rate of energy expended during an activity to the rate of energy expended at rest. 1 MET is the rate of energy expenditure while sitting at rest. By convention, 1 MET is equal to an oxygen uptake of 3.5 milligrams per kilogram per minute. In MET per minute, this is an index of energy expenditure that quantifies the total amount of physical activity performed in a standardized manner across individuals and types of activities, calculated as the product of the number of METs associated with one or more physical activities and the number of minutes the activities were performed, METs per minute. It is usually standardized per week per day as a measure of exercise volume. The kilocalorie is the energy needed to increase the temperature of 1 kilogram of water by 1 degree Celsius. To convert METs to calories per minute, kcal per minute, it is necessary to know an individual's body weight. It is usually standardized as kilocalories per week or per day as a measure of exercise volume. Kcals per minute equals METs times 3.5 milliliters per kilogram per body weight in kilograms divided by 1,000 times 5. So, for example, to calculate the weekly volume for a 70 kilogram male jogging at 7 METs 3 days per week for 30 minutes. You're going to take the 7 METs times 30 minutes times 3 times per week. That equals 630 METs per minute per week, or 7 METs times 3.5 milliliters per kilogram per minute times 70 kilograms divided by 1,000 times 5 is equal to 8.575 kilocalories per minute. Another way of saying this is 8.575 kcals per minute times 30 minutes times 3 times per week equals 771.75 kcals per week. And you can see here, this is the activity status and aerobic training focus. You have the beginner, and really with a beginner, that is for those who are inactive with no or minimal physical activity and are deconditioned. So their aerobic training focus is on light to moderate level activity for 20 to 30 minutes over the course of the day. Accumulating time in 10-minute bouts is also another option, but overall the target is 60 to 150 minutes per week. If they have some minimal prior activity, that previous target has already been met, you want to focus on light to moderate physical activity for 30 to 60 minutes. And again, you can accumulate time in 10-minute bouts as an option, but the overall target here is 150 to 200 minutes per week. For someone who's intermediate, they're sporadically active but don't have an optimal exercise plan and are moderately deconditioned, they have fair to average fitness. So you want to focus on moderate activity for 30 to 90 minutes per day. Overall, you want to get that target up to 200 to 300 minutes per week. And for those that have an established exercise program, they're regularly engaging in moderate to physical activity, you really want to encourage them to focus on that moderate to vigorous activity for 30 to 90 minutes per day. The target would be 200 to 300 minutes per week of moderate physical activity, or 100 to 150 minutes of vigorous intensity, or a combination of the moderate and vigorous intensity. The frequency of resistance training varies depending on the goals of the client. For general muscular fitness, resistance training, the muscle groups, chest, shoulders, back, abdomen, hips, and legs, 2 to 3 days per week is recommended. At least 48 hours should separate workouts targeting any given muscle group to allow time for adaptations to occur. Depending on your client's schedules, fitness professionals or personal trainers may incorporate whole body sessions in which all the major muscle groups are exercised in one session, repeating this sequence a couple times per week. Or may train a few selected muscle groups each session, multiple sessions. In the latter scenario, more frequent resistance training will occur, but individual muscle groups will still only be targeted 2 to 3 times per week. The intensity of resistance training is inversely related to the number of repetitions. So the higher the resistance, the number of the repetitions will be fewer. To improve muscular fitness, typically 8 to 12 repetitions per set are completed at an intensity of about 60 to 80% of the client's 1RM. The greatest amount of resistance overcome in a single repetition. For older and very deconditioned individuals, a lower intensity of about 40 to 50% of 1RM with 10 to 20 reps is recommended initially to lower the chance of injury or muscle soreness after exercise. The number of repetitions selected should allow for muscle fatigue at the end of the set, but not failure. The total time spent will vary with the program, in particular if a whole body program approach is used or if a split program targeting different muscle groups on separate days is applied. For adults, each muscle group should be trained with 2 to 4 sets with rest intervals of 2 to 3 minutes between sets. 4 sets are more effective than 2 sets, but also realize that for novices, even a single set per exercise will improve muscular strength. When determining the number of sets, attention should be made to adherence and thus may be influenced by the individual's schedule, time availability, and level of commitment. Resistance training can be done using free weights, machines, stacked weights, or pneumatic resistance, rubber bands, cords, or even body weight. For examples of different activities that can be used for the major body areas, you want to look at table 13.3. In addition, fitness professionals should include multi-joint or bench press and leg press, as well as potentially single joint or isolation exercise such as the bicep curl, quadricep extension exercises. When selecting exercises, the personal trainer should ensure opposing muscle groups, agonist and antagonist, are included in order to prevent muscular imbalances. For example, including lower back extensions and abdominal crunches to strengthen both the lower back and the abdomen will provide for muscle balance. Muscular groups should be trained for a minimum of 2 to 4 sets. These may be the same exercise or from a combination of exercises affecting the same muscle group. For example, either 4 sets of bench presses or a combination of 2 sets of bench presses and 2 sets of dips may be used to train the pectoral muscles. Progressive overload and resistance training can be done in many ways. One can increase the amount of resistance lifted, increasing the number of repetitions, increasing the number of sets done per day, per muscle group, or increasing the number of days per week the muscle groups are trained. However, if individuals seek to maintain a given level of muscular fitness, it is not necessary to continue to progressively increase the training stimulus. Muscular strength may be maintained by training muscle groups as little as 1 day per week, as long as the training intensity or the resistance lifted is held constant. And this is just an example of a sample resistance training progression. You can see here the beginner is moving through this level. It typically takes about 2 to 3 months. And although they're remaining at this level until they feel comfortable enough, it's really important to do it this way. So you do a total of 6 exercises, selecting 1 exercise from each of the following areas of the hips and legs, the chest, the back, the shoulders, leg, or the low back, and abdominals. You can do 1 to 2 sets. Number of repetitions should be 8 to 12, or if you're working with older adults, maybe go a little bit more moderate, 10 to 15. And number of days per week, 2 to 3 days per week. For an intermediate to established individual, move them through to establish that to a level, typically taking about 3 to 12 months, depending upon their level of consistency. Do a total of 10 exercises. So select one exercise from each of the following: hips and legs, quadriceps, hamstrings, chest, back, shoulders, triceps, low back, and abdominals. So the big difference here is you're adding the triceps and the hamstrings. There we go. You're doing 2 sets, and again, 8 to 12 reps, or 10 to 15 for older adults, 2 to 3 days per week. For those who are more advanced, you can push them through a little faster. Again, doing 10 exercises, selecting 2 from each of the larger muscle groups. You can do that 2 to 3 days per week, 2 to 3 sets, 8 to 12 reps, 2 to 3 days per week. Or you can do a total of 5 exercises and selecting 1 exercise from each of the smaller muscle groups and a trunk exercise or trunk area. So shoulders, biceps, triceps, low back, and abs. You do 2 sets, 8 to 12 reps, and 2 to 3 days per week. And these are just examples of some exercises that you can do for the major muscle groups, hips and legs. So your focus is on the glutes as well as the quadriceps and hamstrings. You can do that with the machine leg press, or you can do the double dumbbell squat. Other types of things, the ankle weight hip flexion and extension, or a band leg lunge. And you can see the others for the different activities there as well. So if we look at flexibility exercises have the potential to improve joint range of motion. I think I need to go back. So flexibility exercises have the potential to improve joint range of motion and physical function. Although the personal trainer or fitness professional may not be able to point to benefits such as reduction in cardiovascular disease risk, stretching is recommended as part of a comprehensive training program for adults. Stretching activities should be included a minimum of 2 to 3 days per week for most adults, although daily flexibility exercise is really most effective. Describing the intensity of stretching to a client can be difficult. That is not a measurable entity like a treadmill speed. The fitness professional can use cues to help guide clients, such as moving within the ROM, range of motion, to point of mild tightness without discomfort. A stretch should not create discomfort. If so, the client should release slightly. It should never be painful. And ideally, the time should be at least 10 minutes as recommended per session in order to allow all the major muscle tendon groups to be targeted with at least 4 repetitions of each stretch. Flexibility can be improved using a wide variety of activities, including static stretching, such as active and passive, or dynamic or slow movement stretching, and proprioceptive neuromuscular facilitation, or PNF. Interestingly, when performed properly, even ballistic or bouncing stretches can be effective as static stretches for increasing joint range of motion and individuals engaging in activities that involve ballistic movements such as tennis or basketball. Each flexibility exercise per joint should be held at the point of tightness for 10 to 30 seconds. The time and duration and repetitions of the flexibility exercise should be adjusted to accumulate a total of 60 seconds of stretching at each joint. Recommendations for using propioneuromuscular facilitation, or PNF, are to hold a 20 to 75% voluntary contraction for 3 to 6 seconds and follow it up by 10 to 3 seconds of assisted stretch. Performing flexibility exercises at least 2 to 3 days per week is recommended, with daily flexibility exercise being most effective. we will go through more flexibility and various stretching programs presented in Chapter 16. Neuromuscular exercise involves motor skills including balance, coordination, agility, and proprioceptive training. These activities have recently been termed functional fitness or movement, and additional information regarding this is found in Chapter 17. But neuromotor enhancing activities focus on the communication between feedback from the periphery, such as the arms and the legs, and the interpretation by the central nervous system or brain and spinal cord. As with any training, providing a challenge or overload will allow for improvements. This training is of particular importance for adults who are at a higher fall risk or who have mobility impairments. In addition, all adults may gain benefits, especially if participation in recreation or occupational pursuits requires agility and balance. Neuromuscular exercise is recommended at least 2 to 3 days per week for 20 to 30 minutes of duration. The previously mentioned populations. This recommendation is based on conventional use rather than evidence-based documentation of benefit, as programs range from 1 to 7 days per week. The intensity of balance-related training can be manipulated by the fitness professional through 3 aspects. Number 1, base of support. The narrowing or the base of support will increase the challenge. The center of mass, displacing the center of mass, increases the difficulty. And peripheral cues, so adding visual, vestibular, and proprioceptive pathways. Again, we'll go through some of this a little bit later on, but it's also in this next table. Here you can see some things that you can do to increase the intensity with your base of support. Less difficult is going to be feet apart and possibly using an assisted device such as a chair or a cane. Moderate would be where feet are together. And to make it more difficult, you can have them do a heel-to-toe stand or a one-legged stand. For their center of mass, leaning forward and backward or leaning side to side is going to be less difficult. More difficult would be having them turn in a circle or shifting their weight from side to side or stepping over an obstacle. Whereas more difficult is going to be a crossover walk or like the karaoke that we did today. Balancing on a large ball or a rocker platform or the Bosu ball. And then peripheral feedback is, again, getting information from the legs and the arms to the central nervous system. And so these are a lot more difficult. You can have them close their eyes and do the activity with their eyes closed. Stand on a foam pad while shifting their weight or bringing their feet closer together. Or in various directions, reducing that base of support as well. So the minimum effective dose balance training is yet to be identified. Improvements have been noted with 20 to 30 minutes or more per day for a total of 60 minutes per week. When activities like Tai Chi are incorporated, typically durations are 45 to 60 minutes, but the minimum effective time for neuromotor exercise training is really not known yet. Various activities as well as Tai Chi, Pilates, and yoga can be used as well. Here you can see this is a progressive balance program. You have level 1, level 2, level 3, and then adding challenges. So a seated balanced activity, standing balanced activity, and then movement balanced activity as well. And this is a sample beginner exercise program. You can see week 1 to 2, they're working on aerobic 3 days per week, about 10 to 20 minutes per day, with a light intensity of a level 4, the 3 or 4 on the Borg scale. And then the resistance, they're doing about 2 days per week, 1 set, 8 to 12 reps of 6 exercises, the major muscle groups. And they're stretching 2 days per week, 10 minutes for those stretching activities. So beginning easy and building up. Week 3, week 4, they're gradually increasing each week. So this is a progressive, you're progressing in intensity as well as volume the amount of time that you're doing. And this is a sample intermediate level exercise program. Again, looking at the time and the intensity of the activities as well. And this is a more advanced exercise program. So 5 days per week of aerobic activity, as well as weights and stretching, and possibly even some of the advanced training options. So fitness professionals may want to consider advanced training options for new clients with an extensive background in fitness training, such as athletes, or for long-term clients who may have made great progress in starting their beginner comprehensive fitness programs. Advanced training options can increase the challenge of an exercise program by manipulating current exercises through the fit, volume, progression principle, frequency, intensity, time, type, volume, and progression. How these fit principle components can be manipulated for beginner, intermediate, and established exercisers, or through prescribing new or additional exercises that focus on the skill-related components of physical fitness. For some clients, development of the skill-related components of physical fitness is a training goal. The skill-related components of physical fitness include speed, which refers to the ability to perform a movement within a short bout of time, such as a 100-meter sprinter moving quickly toward the finish line, or agility, which refers to the ability to change the position of the body in space with speed and accuracy, cutting in a new direction to successfully execute a play in basketball. Coordination refers to the ability to use the senses such as sight and hearing together with body parts and performing tasks smoothly and accurately, such as returning a serve in racket sports. Balance refers to the maintenance of equilibrium while stationary or moving while performing gymnastic moves on top of a balance beam. Power refers to the rate at which one can perform work. A defensive back runs through the offensive line to sack the quarterback before the ball is thrown. And reaction time refers to the time elapsed between stimulation and the beginning of the response, such as a soccer ball kicked toward a goal and the goalie's reaction to block it. These skill-related components can be achieved simultaneously through several types of advanced training options, such as high-intensity interval training, high-velocity weight training, Olympic weightlifting, plyometric training, balance training, sport-specific and non-sport-specific agility, and coordination drills. Personal trainers can use several advanced training methods, such as plyometric exercises, to train their clients to improve power, agility, and speed. Plyometrics refer to the exercises that link strength with speed of movement to produce power, and were first known as jump training. Plyometric exercises begin with a quick stretch of the muscle fibers, or the eccentric phase, and then followed by a fast shortening of the muscle fibers, such as the concentric phase. This mode of training, as well as increase agility levels, because plyometric exercises often change directions rapidly. Another training method fitness professionals can use to improve their client's fitness level is power resistance training. Muscular power production is used in various movements in sports, work, and daily living. Power can be increased through resistance training and by performing repetitions of lower loads at a higher velocity. Some resistance training options personal trainers can use to develop more power in their clients are high velocity resistance training and Olympic weight training. Both modes of resistance training yield increases in power production. Balance, coordination, and reaction time are not only needed for recreational purposes, but also used in daily routines. There are many exercises and drills that personal trainers can use to condition their clients that require them to jump, run, slide, and bound, and non-traditional movement patterns that will develop their coordination, reaction time, and balance skills. All three of these skills involve muscle activation along with sensory integration to perform exercise-related tasks in a more highly skilled way. Flexibility exercises have been shown to increase balance and reaction time. The components of an exercise training session include the following: warm-up, conditioning exercise, cool-down, and stretching. Although the focus of exercise sessions can vary widely, the framework is appropriate for various conditioning stimuli. The warm-up is at a minimum 5 to 10 minutes of low to moderate activity and tending to literally warm up the muscles in preparation for the conditioning phase. This transitional phase provides opportunity for the body to adjust from resting status to the lower physiological, biomechanical, and bioenergetic demands of the conditioning phase. Warm-up activities include cardiovascular and muscular endurance activities. The conditioning phase is the main focus of the exercise session and may include one or more of the following: the cardiorespiratory or aerobic exercise, resistance training, neuromotor activities, and sport-specific activities. The conditioning phase will follow the FIT principles described previously in the chapter and will be covered in greater detail in the upcoming chapters. The cool down involves similar cardiovascular and muscular endurance activities as found in the warm-up, but now the transition is from the higher intensity of the conditioning phase back toward a resting status. During this time of low to moderate intensity activity, the body will experience a decrease in heart rate and systolic blood pressure, and metabolic end products such as lactate produced during more intense activity will be removed, allowing for a gradual return toward baseline that will help the client avoid post-exercise hypotension or low blood pressure and potential dizziness due to blood pooling in the legs rather than flowing back to the heart and brain. The cool down should be at least 5 to 10 minutes and longer for higher intensity conditioning phase sessions. The stretching phase is considered distinct from the warm-up and cool-down phases. For adults in general fitness program and for athletes in sports in which flexibility is important, stretching after the warm-up is typically recommended. Stretching can also be included after the cool-down. For some sports, those focused on muscular strength, power, and endurance, some research suggests stretching following the activity rather than following the warm-up. When properly performed, even ballistic or bouncing stretches can be as effective as static stretches for increasing joint range of motion and individuals engaging activities that involve ballistic movements such as tennis or basketball. And that concludes our discussion for today. I look forward to talking with you again. We're going to break down each of these into separate discussions, if you will, and we will be practicing them as well. I look forward to talking to you soon. Have a great day. Good Lord. Thought I'd